This is Anthony. Anthony has high blood pressure. And here's Dr. Anderson, Anthony's doctor. She prescribes Anthony medication A to help lower his high blood pressure. Anthony takes medication A, and over the next few weeks, his blood pressure numbers go down. The end. Let's think about this. How does Dr. Anderson decide to use medication A to lower Anthony's high blood pressure, and not medication B, or medication C, D, H, or X? Is A really the best medication for Anthony? To answer these questions, let's take a quick look at all the different factors that might influence Dr. Anderson to choose medication A for Anthony. Dr. Anderson knows that medication A is approved as safe and effective for high blood pressure. Dr. Anderson reads research articles, attends medical conferences, and talks with other doctors about what medications they prefer. Dr. Anderson also knows that medication A is usually affordable for patients. And she knows that in general, most of her patients are able to tolerate medication A's side effects. The company that manufactures medication A provides information about why they think it works well. Conversations between a patient and doctor about the patient's preferences can also sometimes influence treatment decisions. Together, these experiences influence Dr. Anderson so that she usually prescribes medication A for high blood pressure for patients like Anthony. But sometimes in usual day-to-day medical practice, more than one option has been approved as safe and effective, so different doctors can prefer different medications. For example, if Anthony had gone to see Dr. Brown might prescribe medication B because he has different experiences than Dr. Anderson that lead him to use medication B with patients like Anthony. Or Dr. Chen might prescribe medication C to Anthony because her experiences are different from both Dr. Anderson and Dr. Brown. What's going on here? Which of these doctors is right? Which of them is wrong? What if I told you that all three doctors are correct because medications A, B, and C are all good choices and all work to lower high blood pressure? But doctors don't only want to give their patients a good treatment, they want to give their patients the best treatment possible. The truth is, all three doctors would say that they do not really know which medication is best. The problem is, sometimes there is just not enough information from research comparing medications to know the best choice for patients. This is Robert. He's a medical researcher. His job is to compare different medications, procedures, and lifestyle choices, like diet and exercise. Robert is going to help the doctors answer their question. Remember, all three medications do work to lower blood pressure, and doctors can choose to prescribe any of these three medications. But what if medication A works faster than medication B and C? Or medication A is stronger than medication B and C? Or medication A is safer than medications B and C? Robert helps to answer these questions. His work is called Research on Medical Practices. Robert does not replace your doctor. Your doctor is still responsible for your care, but your doctor works with Robert using different research methods to find out which medication is better. Medical record review is one method Robert can use to compare medications. Simply by reviewing medical records of what medications patients are on, he can sometimes find out which medications work better compared to others. Reviewing medical records can be useful, but by itself sometimes leads to the wrong answer about what medication is best. Randomization is another research method Robert and the doctors can decide to use to overcome the limitations of medical record review. But what is randomization? Imagine a gumball machine. You put in a quarter and then a gumball comes out. The color of the gumball that comes out is decided by chance, but no matter what color gumball you get, you know it's a gumball. Randomization means a patient is assigned a medication by chance. Some will get medication A, some will get B, some will get C. In medical research, randomization is the gold standard for making comparisons. So how does this look with patients? Robert randomly assigns one of the medications to each patient. Robert can track the groups of patients to see which group does better. Sometimes the doctors and patients do not know which medication has been assigned, but in many studies, the doctors and the patients do know. No matter what, if a patient does not respond well, the doctor can change the medication. And rather than randomizing individual patients, sometimes entire clinics or hospitals can be randomized. This can be a better way to answer some questions. This is Carlos. Carlos also has high blood pressure. And here's Dr. Chen, Carlos's doctor. She's one of the doctors who has patients enrolled in Robert's research to compare medications A, B, and C. Dr. Chen prescribes Carlos medication. Well, it depends. If Carlos is in this research, Dr. Chen will prescribe the initial medication based on randomization. Dr. Chen wants to know if this is okay with Carlos. How does Dr. Chen explain this research to Carlos? Let's look at different options for how to give Carlos this information. One approach is to give general information to all patients coming to the clinic. This information explains how the clinic is involved in research on medical practices. Another approach is that Dr. Chen can ask Carlos to be involved in research. Carlos can give Dr. Chen his verbal permission if he agrees to participate. Or when Carlos is informed about the research, he is asked to sign a form if he agrees to participate. Finally, when Robert has enough data comparing medications A, B, and C, he can tell the doctors which of these medications is actually the better medication. And patients like Carlos and like you can know they aren't just getting good medication. They're getting a medication that has been shown to be better. The end. But wait! This research doesn't end there. It's an ongoing process. Current and new medications will continue to be compared against each other. Because the goal of research on medical practices is finding the best treatments for patients like you.